Okay, so when we talk about full spectrum harm reduction, we need to consider that harm reduction was traditionally thought of to address situations related to HIV mainly and linked to injected drug use and opiates use. So the three pillars of harm reduction are, and historically have been, HIV prevention strategies for people who use drugs, needle and syringe programs for people who inject drugs, and opiate substitution treatment for people who use heroin. So these three things leave out the majority of people who use drugs, which are using what they call recreational drug use or non-injected drug use, that have to deal with stimulants, with psychedelics, with new psychoactive substances, and all these other things that revolve around drug use. So the idea of full spectrum harm reduction is including all of these other aspects of the community of people who use drugs, the different means and routes of administration, the different substances, and addressing all of the social elements that surround these communities and these practices. So then ideally, when we talk about full spectrum harm reduction, we are considering also strategies that address the necessities of people who smoke stimulants, for example. So smoking crack cocaine, smoking methamphetamine includes the capacity or the possibility to develop specific harm reduction kits with supplies in the same sense, in the same spirit as the supplies for safer, how do you say, higienico, hygienic, sterile injecting equipment. I'm so sorry. Okay. So in the same sense as developing the injecting harm reduction kits that include a sterile equipment so people don't share needles, and when we talk about full spectrum harm reduction, we could start addressing these other necessities that include smoking amphetamines and smoking crack cocaine, and this includes the possibility of developing kits, harm reduction kits that include the supplies necessary for safer consumption in any sense. So it moves beyond injecting equipment and it tailors the elements that come within the kits so that people who are smoking stimulants can have the same safety net that comes from their own equipment, not sharing and preventing this same focus on HIV. When we consider other options such as psychedelic harm reduction, and when we think about the impacts of the war on drugs, we need to consider things that go beyond the individual and their decision-making process of what substances they are using. So full spectrum harm reduction is the idea of recognizing and acknowledging that most of the harms that come from drugs and illicit drugs are not necessarily related to the use of drugs and the impact on the health of the individual, but are related to market dynamics and drug trafficking within and under the umbrella of prohibition. So incorporating this into the notion of how can we reduce harms related to drugs, drug use, and within the community of people who use drugs, we need to understand that everything related to how we integrate these substances into our society, into our individual life, can and generates harms, and addressing these harms in specific ways, understanding where they come from and what are the impacts, allows to develop new strategies and new intervention, new models for harm reduction. So recognizing the impact that the production has in producing countries and trafficking countries, so the production of illicit substances in these countries, means that talking about the geopolitical implications, talking about the market dynamics to people who use drugs, will change the way that these people perceive their own drug use. It means that when we identify situations related to the use of non-injected substances, whether it's recreational settings or people who have developed a habit or whatever around the substance that is not injected, they still need the same information, they still need the same attention, they still need health services and access to all these other options of or models of intervention. It means that promoting drug checking or substance analysis or pill testing, it will allow people who are currently outside of the umbrella and the scope of traditional harm reduction strategies to get closer to this sensitizing information, to this interaction based on the peer education model and horizontal model, to this rehumanizing and destigmatizing interaction that allows for people to change the way they perceive themselves, change the way they interact with society, and generate this platform for new understanding and new interaction. It means including every possible substance, every means or route of administration, every possible social context, and every element that is generating harm in any aspect to the individual, to the society, to the community, to the economical and political structures. And then it's a very wide framework to work with, but it's being more realistic, being more concrete, and being more specific about what are the harms that are being generated both by drug policy and by drug use itself.